Hi, it's Karen Damshin with Damshin Financial Planning. And this week we've got a fun Medicare update for you. So the big news over the last week or so has been that Medicare is standing up a temporary program to help cover the cost of GLP-1 drugs for weight loss starting July 1st. So here's what you need to know. Some Medicare beneficiaries will begin to be able to participate in this program called the Medicare GLP-1 Bridge. And they will simply have a $50 monthly copay through this program for their weight loss medication. Now, Medicare's not changing the law right now. They're just setting up this temporary program. And this marks the first time that Medicare will help to pay for drugs that are prescribed solely for obesity, rather than limiting that coverage to people taking GLP-1s for other conditions like diabetes or cardiovascular disease. So even though drug makers have tried to lower the out-of-pocket costs on some of these over the last year or so, many patients are still paying about $350 a month. So that $50 copay looks pretty attractive. Now, this program will run between July 1 of 2026 and December 31st of 2027. And then they'll probably reevaluate it in some way. So we should know this is a temporary program. You also need to be enrolled in Medicare Part D, so you do need to have an eligible drug plan to be able to receive coverage through this bridge program. But to qualify, your patient's provider, so your doctor, just simply submits a prior authorization request showing that the patient is being prescribed a GLP-1 for weight loss. Then it goes through this prior authorization process to clear the way for the pharmacy to fill the prescription. And of course, your provider must also demonstrate that you, as their patient, meet certain clinical criteria relating to your body mass index or your BMI. So there are a few different criteria related to that depending on what your BMI may be. Now, you will not be eligible for coverage through the Bridge program if you already have a GLP-1 prescription under a Medicare Part D plan for certain conditions, such as type 2 diabetes or sleep apnea. So certainly if you think you may be eligible for this program, you want to make sure you reach out to your doctor and ask. Now, as far as the medications that will be covered, not every weight loss drug is going to be covered. But at this point, they are covering Fundeo, which is Eli Lilly's weight loss pill, as well as the Zepbound Quick Pen, and then Novo Nordisk's Wegovy, both in injection and pill form. So reach out to your doctor if this is of interest for you, if you think that you may qualify for this program. And know that you don't have to have met your deductible in order to qualify for the $50 copay. But also your $50 copays will not count towards that $2,100 max out-of-pocket cap on your drug costs for 2026. Of course, if you have any questions, please reach out to me. I'm always happy to answer them. And I'll be back in your inbox again next week with another update.